Hello, and thank you for being here with us in Vienna for the Neurotrauma Simulation Center. I would like to ask you a few questions, starting with if you can tell us a few words about yourself, your role in your country delegation, your background and focus.
First of all, thank you for having me. My name is Dabala. I'm currently a neurology resident at the General County Hospital in Cluj-Napoca in my second year. I recently became interested in neurotrauma, following taking care of some interesting cases at my place of work. Regarding the current team organization, the delegation that comes from Romania, I think my role is mostly one of accumulating knowledge that I can, and then I should apply for myself and for the treatment of neurotrauma patients back home. Regarding the neurotrauma management in Romania, are you satisfied with this? Do you have any ideas how it could be improved? I think there is room for improvement, mostly regarding the communication part between the specialties that take care of the neurotrauma patient, and also regarding the long-term follow-up of the patient. As for challenges in the treatment and research of neurotrauma, which would be these in Romania? Mostly the treatment comes again the long-term follow-up of the patient, because the long-term follow-up means that a lot of dimensions that are a result of TBI, like behavioral, cognition and psychological problems, are not identified and therefore not treated. And regarding the research, Romania has some experience with research in TBI, but the most problematic parts, in my opinion, are the fact that we don't have a registry from which we can construct databases, and the fact that sometimes the patients that are enrolled in the clinical trials that we try to establish are hard to follow up. Sometimes we lose them. Sometimes they don't want to come to perform the interventions or to assess them for the following visit. I think these are the most important. I see. What is your opinion about an international TBI registry, and how do you believe it could impact the TBI management? I think it's the most important thing that we should start with, because, as I said, we need data. And regarding our project, the present registry, the most important aspect is the fact that it's an international project, so we could have data from multiple countries. What do you believe to be the main obstacles in collaboration in a multidisciplinary team? Mostly because in Romania, the specialties are not accustomed to a multidisciplinary integration of the TBI patient. I think they will each want to put their part of their specialty in front, and I think this would create not really confusion, but problems mostly for the patient, because these discrepancies won't come to something good in the end. If we talk about prevention of neurotrauma, which are the main challenges? I think the most important things that we should do are the public campaigns. I know that a lot of public campaigns have been done previously in the past, but their impact was mild to maybe non-existent. And I think we should assess more on the psychological aspects that traumatic brain injury can produce. So we should show the patients things in a more realistic way when we do these campaigns. Well, what are, in your opinion, the most important quality indicators in neurotrauma care? I think the fact that the patient is assessed from all the dimensions. We can see that we identified some problems, that part was done, even if we didn't find anything. And the fact that we try to implement some new technologies like, let's say, ICP monitoring, or perform all the imagistics on time to see how the level of hemorrhage evolves. I think it involves multiple aspects as well as the general picture.
And one last question, were you familiar with the AMN organization before?
Yes, I recently participated in AMN Congress, which has taken place for 2 days, right before the Neurotrauma Simulation Center. I'm accustomed to some of the speakers, and I know that the general projects and the general lines of development of the academy.
How do you feel about an online community for those who are interested in neurotrauma? Do you think it would benefit for those who are involved in their medical career?
Yeah, I think it would form a great get-together group, which bring us together, and we would have the opportunity to share from our experiences. So I think it would be a much needed idea.
Okay, thank you very much.
Thank you for having me.